AP. Okay, welcome to the Duke Spine Institute live surgery broadcast. It is 8/8/23. Dr. Duke Majan had to cancel a couple of surgeries earlier because of different issues. One patient did not tolerate our sedation and the other one did not tolerate ventilation. So, two good reasons. Safety always comes first at Duke Spine. That said, this patient is having two discs that we're going to fix. Num num. Did I already number? The L4-5, the L5-S1. We're almost at the L5-S1, but I want to stop short because I want to make sure she's a little more awake. So right now I'm going to make my incision, 7 millimeters. We're going to fix both discs with one tiny incision, a 7 millimeter incision. Blood pressure is good. All right, shot. Now the 5-1 is going to be hard to get into. You can see it's collapsed. Show us, Jordan. The 4-5 is a bigger disc. Shot. Are we on anti-inflammatories? Let go. All right. Shot. 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 All right, at this point I want her more awake, so I'm going to give her a few minutes and then we'll wake her up.
Hello, my friend, how are you? Don't move your head, okay? You awake? Can you open your eyes? Perfect. We're going to ask you some questions.
Everything's okay. We're just going to ask you a few questions. Dr. Duke Majan here. All right.
You're doing great.
So, how long has she had her back pain?
She had a ladder accident in January, and before that it was a year and a half of pain. So the ladder accident exacerbated her sciatica.
So let's just say 8 months. Okay. And based on her MRI findings, I believe her pain is coming from two discs. Can you hold this here? A little pressure. I think it's coming from L4-5 and L5-S1. The difference between these two discs, L4-5 is herniated, L5-S1 is also herniated, but L5-S1 is also degenerated. Jordan, show us the tallness or height difference. Are you okay? You're doing great. Yeah, that's a normal height of a disc, and show us, see how collapsed that disc is? It's about a third of the height of the other one. Okay, we're going to put you to sleep in a few minutes. I need your help right now. Where do you feel that?
Your back or your leg? Where are you feeling that? Where?
AP.
The back area?
Okay, you're fine. That's where we expect you to feel it. Looking good. Could be a little more medial at 5-1. Shot. All right, so shot. 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 Where do you feel that? In your back?
Where are you feeling it? Hip area.
Yeah, that's normal. All right, we're going to put you to sleep in a minute, okay? I just got to run some tests. So, you know, based on where she showed me her pain is and based on the MRI, I believe her pain's coming from two discs, L4-5 and L5-S1. Of course, L5-S1 is more collapsed. And then L4-5 is more normal looking, but it's still on the MRI damage, pretty bad, and I think her pain's coming from there. Are you comfortable? You having any back pain?
How bad is that?
How bad is that on a scale of 1 to 10? How high did it go? 10. Is that where you typically get your back pain? Yeah. All right, 10 over 10 concordant at 4-5. Good girl, we're almost done. We're going to put you to sleep. Get ready. You're going to feel some medicine going in your arm. That's normal. Don't be upset, okay? That's just the sleepy medicine. How bad is that on a scale of 1 to 10? Huh? All right. Is that where you get your back pain? All right. So, okay, we're done. We tested both this. They were both 10 over 10 pain. So we're going to fix that pain for you. When you wake up, it'll be gone.
Yeah, that's the propofol.
Yeah, that's the medicine going in the sleeping medicine.
Okay, just
You're
relax.
good. Everything's good. You want to do 4-5 first, Luis? All right, very good. So the first disc we're going to treat is L4-5. Shot. Shot. So what we know so far is that our clinical diagnosis was that her back pain was coming from the L4-5 and L5-S1 discs. Shot. And now we know after testing the disc with the discogram that, yeah, 100% the L4-5 and L5-S1 are definitely causing her back pain that she has every day. The pain she wants to get rid of. Shot. So we're going to help her get rid of that today, right now. That pain will be gone when we're done with the surgery. Any questions from our audience?
Yes, we have a question from Canes25 on YouTube.
Hi, Canes25.
They ask, is
Sure.
the upper levels of the cervical region a more difficult challenge, and can this region cause dizziness or other abnormal issues?
The upper levels of the cervical, like C3, 4, 4, 5, are generally easier for me to get to for my surgeries. And can they cause dizziness? I don't think they cause dizziness, but they can cause balance trouble. So dizziness, when I talk about dizziness, it means your head is spinning. Literally, your head is spinning. That's dizziness, okay? But balance difficulty, because your spinal cord is being affected. Come on, Jordan, I need you taking pictures. That's different. Jordan. Come on, Jordan. Let's get with the program. Don't wait for me to tell you. You should be looking at the advances and making pictures as we keep going. Uh-huh. All right, so no, I don't think true dizziness comes from the cervical spine. However, you can have gait instability, clumsiness of your arms. All those things are possible. But dizziness, to me, like you're lightheaded, things are swimming, everything's going black in your visual fields, you're passing out, like that kind of dizziness does not come from a herniated disc. I mean, if that's happening, most likely dehydration. Especially these days with all the heat. All right, very good. Shot. Well, we've been plagued today with 2 cancellations, as I mentioned earlier. The first one, the patient was way too sensitive to the medication we use for putting him to sleep, so we're going to have to bring him back and do it under general anesthesia with a tube down just to protect his airway. The second patient, we had we think had some bronchitis, and it made it very difficult for her to ventilate, so we had to cancel her as well. We're always going to side on the air of caution at Duke Spine. Spine surgery should not result in complications. We do everything we can to prevent them, and safety of the patient is always number one. So I'm sorry that we couldn't show you more surgeries today. We're just as disappointed as you guys are, trust me. All right. So this is our 4th and final case for today, but really our second. Henry, you want to show our audience how is it that a herniated disc can cause so much pain? Welcome back, and you can see how a herniated disc, bulging disc, ruptured disc, all the same thing, how they actually cause pain. It's through inflammation within the tear in the back of the disc, called the posterior annular tear. All right, this patient is having 2 of her lumbar discs repaired with our laser procedure here at Duke Spine Institute in Melbourne, Florida. Anybody know where she's traveling from?
Yes, Pensacola area,
Oh,
Panhandle.
northern Florida, Pensacola by the Panhandle. All right.
She's an RN.
Huh?
An RN.
She's a nurse. Okay. Yeah, I met her parents. They're lovely people, mom and dad. And she's very nice as well. She told me 2 of my surgeries. And that convinced her to come here and get the laser surgery done.
She said she didn't want the big scar and she didn't want the heart.
Yeah. Well, I know some of the spine surgeons in the Panhandle, and they're fusion happy up there. They'll fuse anyone that will lay down for it. Very good. Any questions from our audience?
No current questions, but we do have a comment from Kit on YouTube.
Hi, Kit. Welcome back.
They said, "I wish someone famous like Elon Musk came to see you, so the world can hear how great
Yes.
your surgery is, and so the insurance company starts to cover the every DLDR."
I agree, Kit. Very.
He has a neck problem, Elon Musk. I read an article about it.
What's that? Yeah, no, he does have neck problems. Yeah, Kit, and very well said. So that, as Kit said, every insurance company will cover it every time. That's the problem, is that we do have some insurance companies covering the surgery, but not consistently. And we really need consistency so that we don't have to charge patients any money except for what they're supposed to pay, which maybe even someday, if we really get a big V on this one, a big W, big victory or win, we can get the insurance companies to waive everybody's copays so that basically they will reward you as a patient for coming here to get this done because they know it works. And then you won't have to go into pain management for years after your surgery. Like a lot of patients that have open back surgery, they end up in pain management for the rest of their life. And so pain management costs money. It also takes people away from their lives, their work, their hobbies and things, because you're in pain all the time, you're in pain management. And of course the pain management doctors love it because they make a lot of money having you come back and doing treatments. We have pain management here, but what we've learned over the years is with the right treatment, you can avoid long-term pain management. You can actually do the DPR, Duke plasma rhizotomy, or the DLDR for the discs. You can get rid of people's back pain, and then they don't have to keep coming back for pain management. Great point. And yes, it would be wonderful if somebody like Elon Musk, and I'm sure they will eventually, trust me, they will. Because the surgery is too good for people who are, who have the means to do it. They're going to want to do this surgery over anything else out there because the other surgeries are not as good outcomes. And of course, they have complications and people have to keep coming back. So anybody that's able to afford the surgery will be getting it done. The key is making the surgery affordable to everyone. That's really our goal. Great point. All right, just about done here at L4-S1. Remember, the L4-S1 is a nice fat disc. It's juicy, it looks good for the most part. There is some scar tissue that I'm dealing with right here from chronic inflammation. But the L4-S1 disc, for the most part, it was a 10 out of 10 pain. When we tested it just a few minutes ago, she said, yep, that's my pain, and it's a 10 out of 10. So we know it hurts. We know it's hurting her. So I know we're doing the right thing by fixing it. And then the L5-S1 we're going to get to next. That was also a 10 out of 10. All right, let's just show the audience our video on how exactly the Duke laser disc repair works.
Disc herniations are a common cause of chronic back pain.
Okay, now you understand what the Duke laser disc repair is all about. We go in and clean out that tear like I'm doing right now. I started at the bottom of the tear. Oh, by the way, it's just a nice little fun fact. These tears in the annulus, in the lumbar spine, there's around 20 layers of annular fibers. 20 layers, and each layer is about 1 millimeter. So if you think about it, the average lumbar annulus is really about 20 millimeters thick. Now remember, this tube that we're looking at right now, that's 7 millimeters on the outside, and it's about 5.5 millimeters on the inside. So the thickness of the annulus, a lot of people don't realize it, but you know, if you go from side to side, that's 5 millimeters. That's 4 times that distance is how deep we go into this annulus tear to clean it up. Just a fun little fact. All right, we're pretty much done here.
Lights on, please.
Let's just look here, Luis. Let me see. Let me clean that right there. A little bit of little scar tissue in the side of the disc there. Very good. Very good. Pretty clean. No surprises. Looks good. The nerve root is going to be right up there in that fat. Can't really see it, which is fine. We call that in the foramen, in the neural foramen. It's outside of the disc, just outside and above. So, all right, any questions? Little antiseptic.
No current questions.
Well, those of you that have watched our surgeries for years, you know canceling cases for us is pretty rare, but we had to do 2 today. So that's extremely rare, but it was necessary for patient safety reasons. So we didn't have much of a broadcasting today. The first patient today didn't want to broadcast, so we had to respect his wishes not to broadcast. Yeah, he's doing great. He already left a long time ago. Second patient, like we said, didn't tolerate sedation. Not everybody does. And you never know who's going to tolerate sedation until you try. Right? You can never predict it. But now that we know, we're going to bring that patient back and we're going to do general endotracheal anesthesia. So we'll intubate him, put him to sleep for the whole surgery. That way he can be ventilated properly and
The key is catching it early and then discontinuing it,
yeah,
going with another type of anesthetic.
that's right. So Dr. Berndes was saying the key is catching it early, which we did. And the last lady we think just showed up with some bronchitis, so we had to cancel her. It's not safe to do surgery when people have bronchitis, because what happens is they're,
They have airway inflammation.
yeah, they have airway inflammation. Looking good.
Inflammation is not good, whether it's in the lungs or
Or in the disc.
region of the disc.
Yeah. All right, very good. She's sleeping comfortably. Shot. I need to keep the guide wire shut without taking it out accidentally. I got to remove this needle. So I've done that. Now we got our guide wire in place. I'm going to bring my dilator down over the guide wire. Give a little bit of shot, more numbing medicine to this patient. Actually, let me go a little bit deeper. Shot. Looking good. Leave it. Shot. So I'm in the muscle right now on the side of the spine, and I'm going to give her a little more numbing medicine, a little more feel-good medicine. The more numbing medicine I use, the less propofol and fentanyl my anesthesiologist has to use. So we work together to try to minimize the use of drugs that are more dangerous, like propofol or fentanyl. Shot. And instead use local anesthetics as much as we safely can. All right, great questions so far. Any more questions from our audience? Shot?
Yes, we have a question from Canes25 once more on YouTube. And they asked, is there any good movies lately to recommend?
Any good movies lately? No. I wish I could say yes, but truth be told, I haven't been watching too many movies lately.
I like the Sound of Freedom. I thought it was excellent.
Sound of Freedom. Dr. Berndes says Sound of Freedom.
Highly recommend that as well.
I will say that I did watch a movie with my daughter. It's an old movie. She and I have been watching some movies lately before she goes back to school. We watched The Lincoln Lawyer.
Oh yeah, that's good.
Great movie with Matthew McConaughey. Shot. She has kind of a short disc space. Shot. Let's see about that. Now my daughter went out on her very first date just last weekend, Friday. I asked to meet the guy, but she hasn't brought him by yet. Yeah. It's okay. I trust her. I know, Luis, I know. I told her, bring him by so we can go shooting. I've got 2 AR-15s. I want him to shoot one of them with me. But in all seriousness, it's, you know, when you have a daughter who's dating for the first time in her life, it's, as a father, you worry. But I've talked to her about the guy. He seems like a gentleman, and he's a good student, athlete, respectful, treats her well. What else can I ask for, right? So, her favorite restaurant is Chipotle. My daughter's a lot like me. I literally lived off $10,000 a year for years when I was a med student and at USC in Los Angeles, living near Pasadena. I lived off of the street carts outside the med school. They used to sell burritos and they would sell fruit in a bag. And I had to pay my dorm. I had to pay for food. I had to pay for my gas and car and everything, $10,000 a year. My debt. Oh yeah, and I had to pay. So what I did was I borrowed money. You probably borrowed money too, right? Berndes? I borrowed $40,000 a year. $30,000 went for tuition. $10,000 went for living. And yeah, I did that for 3 years. So I accumulated a couple, $120,000 worth of debt just in 3 years of med school. First thing I did when I made my first paycheck is I paid off my debt. I mean, I didn't pay it off with one paycheck, but I spent my first year as a neurosurgeon making money paying off my medical school debt. I remember the dean of the med school met with us the first week at USC in Los Angeles, and he addressed the entire student body. And he said, "Welcome to USC," you know, all the usual blah-de-blah. And then he said, "One thing I want you to think about. If you live like a doctor when you're a medical student, then you will live like a medical student when you're a doctor."
So true.
Yeah. He said, save your money. Don't go out and buy expensive things. And, you know.
I had a friend in med school that started med school with $250,000 in debt.
Really? Started in med school with $250,000
Yep.
in debt?
He went to Harvard.
Oh my gosh, that's horrible. Those people are indebted the rest of their lives. I mean, yeah, it's horrible.
Now, I'm sure he probably paid it off.
Yeah, maybe. It's a shame. You know, but it is, yeah, now you...
Debt of anyone in my class.
You read about all these Biden wanting to release student debt. You know, I don't think that's right personally. I usually don't get political, but I mean, I paid off my debt and I paid off my wife's debt. The two of us did, and you know, I don't think it's right for the taxpayers to be expected to pay off people's educational debt. How much time do we have? 5 minutes. Yeah, I'm just pulling out the herniation fragments. Any questions from our audience?
Yes, we have a question from Kit on, YouTube.
Sure.
And they said, I will have a Zoom call with you on this Friday. I have back pain only on the left side and start from facet to the left, around from L3 to S1. Does this sound like facet joint pain?
Yes. Yes, Kit, you're right. If your back pain is lateralized to one side, and it's typically about 2 finger breadths off of your midline, your middle. If you're 2 finger breaths off the middle to the left side, from about L3 down, then it's facet pain. That's right, you're very perceptive. But the good news is we can fix it at Duke Spine with the Duke plasma rhizotomy. And it's a permanent fix. We've never had anybody come back and need more treatment for it. Whereas if you go get an RFA, RFAs are all temporary, and it's going to keep coming back, the pain is. So you'll have to keep getting RFAs the rest of your life. So when we do RFAs at Duke Spine, we have the same results as everybody else. So for years we were doing RFAs and patients were coming back and they would just keep getting their RFAs done. And you know, I said to Dr. Patel one day, why does the pain keep coming back? And of course he said, I don't know. And I started thinking about it for a while and I realized, well, the pain's coming back because the nerve that we're targeting is not being destroyed properly. That's the only explanation, it's growing back. Well, if you don't cut the nerve completely, it will grow back. So I started thinking, what if we cut it completely? Pain shouldn't come back. And sure enough, I drew on my experience as a neurosurgeon, realized there was a way to cut that nerve completely. That I do it all the time in surgery. And so I took that technique and I applied it to the pain nerves, and now we've been doing it for over a year, and we've got great results with permanent elimination of facet pain, as well as the SI joint, and we're doing it for hips too, knees. All right, so I've just got this little bit left here medially, and it's an interesting herniation. It's not like chunky, like a lot of them. It's kind of trying to avoid me. All right. Well, I hope that answers your question, Kit, but to me it does sound like facet joint from what you're describing. Of course, once I get to see you in our meeting, I'll have a better idea. Could verify that for you. All right, we got about 5 minutes maximum left. Just working on whittling down the herniation here, breaking it up with the laser into little pieces, and a lot of the little pieces are floating up and out. If you look carefully, you'll see them zip on by. 3 minutes. Any other comments or questions?
Yes, we have a couple comments from Kane25 once more on YouTube. And just jotting back from the first date, they said, when you meet the young man, just tell him you've been to prison and aren't afraid to go back. All you got to say to him.
I love it.
That's what he said. Yeah.
One more time. I'm
No, you're
I'm
good.
sorry, I must be having a brain fart. So when I meet oh yes, that guy.
Yeah.
Yes, that guy. Okay, yeah. No, you're right. You know what scene I absolutely love? You guys ever see
Bad Boys?
Bad Boys? Yes, Bad Boys.
Will Smith with the bottle of Jack Daniels and the 45.
Yeah.
Taking the gun at him.
It's Will Smith and it's what's his name?
Martin Lawrence.
Martin Lawrence. My favorite scene.
I was shocked when I saw that.
Yeah, but I can't do that, brandishing a weapon. I'd probably go to jail for it. Those guys won't go to jail for it, but
Your daughter would be too happy.
no. But that is a great scene. You guys know what we're talking about?
Yep.
Everybody knows that scene. Great movie.
The boyfriend's name was Reggie. Reggie, you better have her home by 10 o'clock.
Yes. Yeah. Huh?
I remember Reggie with the red shirt on, all shot
Mm-hmm. With his braids. All right. Well, to be honest with you, my daughter is, she's quite a handful. So, any guy that can handle my daughter, I worry more about the guy. My daughter, she's going to be a senior. Still in high school. Yeah, my son has graduated. He's going off to Princeton. But my daughter is still in high school for another year. She can hold her own. My son, when he was a black belt in Taekwondo, got my daughter upset. She's a year and a half younger, but bigger, like meat, strong, super strong. She looks like one of those women that play in the NFL. Like she's built with big muscular body. She's tough. Anyway, she pinned him down. It wasn't hard for her to do. A lot of people don't know this, but my grandfather was the champion Greco-Roman wrestler of Egypt. All of Africa, as a matter of fact, back in 1918, 100 years ago. So there's wrestling in our blood. My daughter definitely inherited that. My grandfather would be proud of her, my father as well, if they were alive today. I always say I don't need to carry a weapon, I just need to have my daughter. All right, just about done. One more minute. I'm trying to get the last of this herniation here. And it's really socked in pretty bad. I don't want to leave it. I want to get as much of it as I can. A little bit of fat right there, no big deal. I'm going to just look around. Looking good. Just getting a little bit of the foraminal fat. That's what we're seeing right there. Maybe 1 minute left. Let me just try a little bit more here. Almost done, sweetheart. All right, I think that's everything we can do. That's it. Scope off. Lay still, we're done. You're doing great. All right. So she had 2 discs fixed. I think she's going to do fantastic. We tested these discs before we fixed them. They were a 10 out of 10 pain. So I know they were hurting her. She said it was her typical pain she gets all the time. You can see all the little pieces of herniation out here around the cloth. Whole surgery was done through a tiny cut on her back, just 7 millimeters. I'll show you guys in a minute. You can see the metric here, right, Henry, Sanjay?
Yes, we can.
Yeah. You can see the little cut right here. I cut it, looks like it's around 9 millimeters today. All right, any questions for me? Type them up. I'm going to come answer them for you face to face. But her surgery went well. She was comfortable through the whole surgery. She was sleeping. No tube down her throat, just sedation. We were able to fix both discs. Good job, Luis. Thanks, everybody. You guys did great today. Sorry it was such a stressful day. All right, type up your questions for me, and I'll be there to answer them for you. Ray Tech off the field.
Good
Good morning, I'm Dr. Duke Majan at the Duke Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Duke laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day, and I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm 1/4" incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Duke laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do? Because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so, being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are pain-free for the first time in many years.
Many years, many years.
Congratulations.
Yeah. Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, why are you going? Why are you going to Florida? Why don't you find somebody in Sacramento? And I said, well, because I was referred to Dr. Duke Majan, and I've done a bunch of research on him, and I just have a great feeling about him. Not only that, he personally called me on the telephone because I told his people that I had some questions, and that's what sealed the deal. And so it took a while to get here, but it was worth everything. And I would recommend anybody send your MRI to this guy, and if he can help you, he will. Okay? Thank you, Doc.
You're welcome, sir. It's my pleasure.
Yeah, absolutely.
All right, go enjoy the rest of your
All right,
life.
thank you.
I hope you enjoyed that testimonial. It's always good to see people getting better with the right treatment. At Duke Spine Institute, we have specialized treatments for disc pain as well as facetoid pain of the spine. So this patient we're talking about, she had 2 herniated discs, and I found a Wendy's straw for you so I could illustrate what we did today. She had a herniated disc at L4-S1 and another one at L5-S1. So we came in through the back, and people are wondering, well, what are you doing that's different, Dr. Duke? Well, most spine surgeons will come in the middle, peel the muscle off the spine, and then they'll start removing all these bones here to get down to the disc. But Dr. Parvis Camden figured out out of Pittsburgh back in the late 90s, he figured out, well, why are we going through all the bone and removing parts of the spine to get to the disc when we can actually come from the side and bring a tube in? And that's really what we're doing. We're working through this tube using an endoscope, and we're working right on the disc because that's where the endoscope is docked. Do you guys see that?
Yes, we do. Yep.
So rather than coming in the middle of the spine, we're coming to the side and we're going through the foramen. It's called transforaminal. And we did that for the L5-S1 as well as the L4-S1. And I was able to clean the tear in the back of the disc using the endoscope and the tube. And the surgery went quite well. I expect the patient to do very well. She had a lot of pain coming out of those 2 discs. We tested them before we got started. She had 10/10 pain when I injected a little bit of saline in there. It really, you could hear her go, ah! That's because those discs are causing her daily pain. We confirmed that with the discogram test. It's the only test in the world that lets a doctor know for sure that a disc is causing someone's back pain or neck pain. All right, let's go to our questions.
Questions come from HB.K on YouTube.
HB.K.
And with these questions, they asked, first one, are you inject thrombin and steroid? And the second question is, with the laser repair technique, is there a duralumin tear risk? Risk is spelled R-I-S-C.
All right, let me try to answer these questions. So we do not inject any thrombin at all in the patients. And the irrigation you saw was betadine, which is iodine-based irrigation. Okay. And then we're not sealing the disc hole. That's going to close naturally on its own. We don't need to put anything in there. And then the other question was, is there a risk of tearing the dura?
Yeah.
Absolutely. Anytime you do spine surgery around the nerve roots, you could tear the dura and cause a spinal fluid leak. But of course, I've never had a spinal fluid leak with this procedure. We've done over 1,600. So it's safe. The risk of spinal fluid leak is very small, as long as you do the technique right.
That is it for questions.
Okay, great. Well, I hope you enjoyed the live stream today on Facebook, YouTube, Twitter, LinkedIn. I guess Twitter is now called X.
Yeah.
So, and we'll be back on Thursday for some more surgeries, okay? Thanks.